Hello, everyone, and welcome to News You Can Use. And I have some personal news at the end of this news series, so hang in there. All right, we're going to start with Korea Biomedical Review newsletter here. And this article was written by Lee Han-soo. Seoul National University of Bondag Hospital revolutionizing patient care with 5G technology. So let's see what's going on here. In partnership with Korea's telco giant KT, Seoul National University Bondag Hospital has harnessed advanced information communication technology to construct an exceptional smart hospital based on a 5G specialized network. While the hospital has a long-term plan to transform itself into a leading smart hospital, this innovative collaboration has already resulted in the implementation of 3 cutting-edge systems: autonomous mobile robot, 3D robot education, and self-driving electric wheelchairs. Okay. The hospital said all these technologies aim to enhance patient safety, optimize hospital operations, and fortify medical capabilities. Heavy carts laden with medical supplies are no longer a burden to hospital staff at the SNUBH, thanks to the introduction of AMRs. The AMRs now seamlessly transport surgical instruments, medications, linens, and other essential items required for patient care across a distance of approximately 300 meters between the main building and the Healthcare Innovation Park. Previously, these items were laboriously transported by vehicles and mainly pushed by staff, which was burdensome for the hospital staff, especially during peak hours. The introduction to the AMRs during off-peak hours has reduced congestion, minimizing the risk of infections, and improving patient safety. That's cool. So the hospital has recently established a smart simulation center facilities, stimulation-based training in real-life hospital environments. As trainees immerse themselves in real-life scenarios, they learn to make critical decisions and handle complex situations as physicians and nurses, honing their skills effectively. That's important. Let me see. Other features of the wheelchair include its hill start assist and hill descent control features, which maintain steady speed in inclines and descents, preventing accidents and injuries. This autonomous wheelchair has the potential to streamline wheelchair management efforts as well. Leveraging the 5G specialized network, hospital staff can remotely monitor wheelies' location, status, and battery levels, facilitating automatic retrieval to storage areas when not in use. Interesting. Let's see here. Designed to prioritize safety, wheelie employs simultaneous localization and mapping technology and light detecting and ranging sensors to navigate hospital corridors to transfer patients autonomously and return to designated waiting areas in unmanned mode. Whoa. That's going to feel really strange. But I truly prefer to be in my power wheelchair when I'm at the hospital, just because the distances are long and it just, I don't have to do all the transferring. So yes, I think that powered chairs will be incredible, and we'll have to see how this hospital does with these new autonomous chairs. From there, we're going to go to Denver, and this has to do with vans that are run by sometimes county companies, sometimes private companies. So here in Milwaukee, in my state, in Milwaukee, Wisconsin, we have what's called Transit Plus, and it's very similar to this story. So let's listen here to the Denver Right newsletter. And this article was written by Rebecca Tauber. So thank you, Rebecca. RTD's accessible services can be hit or miss. Here's what some wheelchair users say they've faced while trying to get rides. Joe Beaver had just left a performance at the John Hand Theater in Lowry, and it was time to get back home. For Beaver, who uses a wheelchair, getting to the theater was rather easy. He'd booked a ride in advance with RTD's Access a Ride program that serves people with disabilities who cannot always use the bus system. It took about half an hour to make the 12-mile trip from his home to the theater. Beaver had pre-scheduled a trip home, as the service requires to pick him up from the play. But because the performance ran a bit longer than he expected, the Access a Ride van could not wait for him, and he ended up being stranded at Lowry. It took him 4 hours to get home. And there's a great picture of him. For some people with disabilities, RTD's accessibility services work well, but people in wheelchairs like Beaver have ended up stranded for hours. When Beaver realized he'd missed his ride, he had two choices: join RTD's on-call list, which could take hours, or order a ride share through Access on Demand, a newer program that lets Access a Ride passengers use on-demand ride shares as an alternative to RTD pays for the first $25 of the trip. Must be expensive. Beaver called an Uber and requested a wheelchair access vehicle and was told a driver would arrive in 19 minutes. After waiting that long, the Uber app told him no drivers were available. So he ate dinner nearby with a friend, checked again, and still found no drivers. He headed to the bus stop where the regular 6 o'clock bus failed to arrive. Oh boy. We sat there in the misting rain for an hour, Beaver said. He caught the next bus, wheeled himself down Colfax in the heavy rain to make his transfer, and finally got home. This story might sound familiar to some of you, and to myself as well, because private rideshare companies are not required to provide accessible vans. On-demand services are often less accessible to people like Beaver. Wheelchair users who qualified for Access a Ride either have to wait long periods of time for an available accessible van, or stick with Access a Ride, which requires advanced planning. So this story goes on and on. But, you know, Denver is not a city where the company provides wheelchair rides, according to the Lyft website. In Denver, we work with the local companies to provide wheelchair access transit options, wrote Lyft spokesman Eric Smith when asked about wheelchair accessibility for rides in Denver. Uber did not respond to Denver Ride's request for comment. So, you know, this is the issue everywhere in the United States. This is not a Denver issue. This is for every state. We have these issues. So it's a long article. I'm glad they covered it well. So I'm hoping that Denver will continue to work on access and with more diverse ways of getting a ride, you know, because it's difficult. I mean, if you drive, you can get anywhere at any time, any day. But for us, we have to plan way in advance and schedule rides. And then if our event goes longer, then we miss our ride. And then we have to wait 4 or 5 hours to be able to get home. So it is not easy, and to have a diverse ways or diverse companies in the city or diverse options for us to be able to grab something when our scheduled van can't be scheduled, then we need a backup plan, and that's what does not exist for us. Our backup plans, when the company that we use just can't serve us in the way that we would like to. And can they do that? I don't know. I think that it would probably drive the drivers crazy if they were driving all over the city picking up people at the last minute. So disability rights advocates want to see RTD work to improve the original access a ride system and work toward better on-demand services that serve people in wheelchairs. So Denver, good luck, and I'm hoping that a better plan will happen for you and for the wheelchair users. So this is not new to any of us. So Cincinnati native, we go to Cincinnati to WLWT5, and this article is written by Matthew Dietz. Cincinnati native set to compete in Miss Wheelchair USA this weekend. All right. A Cincinnati native is to compete Miss Wheelchair USA this weekend in Cuyahoga Falls. I hope I pronounced that correctly. Margaret Long serves as Miss Wheelchair Ohio USA. Long is a longtime gun violence advocate in the city after she was shot several years ago, leaving her paralyzed. Now, Long is using her experience to motivate others and to keep people, especially young people, safe. Long will hit the road on Thursday and is hoping to bring home another title. So, Margaret, good luck to you. And anybody from Cincinnati, cheer her on for sure. All right. Now, this is a topic we've covered before, but here is a concrete story of those issues. This news is brought to you by WFTV 9, and this was written by Samantha Manning, CMG Washington News Bureau, and Nikki DeMarco, WFTV.com. So this is Washington, D.C. For Dominique Howell, finding a place to live that she can afford and access with her wheelchair has been a lifelong struggle. It's always been a challenge, says Howell. It's a challenge that she says too often strips people of their dignity. In every house or apartment I've ever lived in up until this point, which is only last 5 years, I've had to either leave my chair outside of the bathroom or leave it in the hallway or another room and either be carried in the bathroom or have a commode-like toilet in my room, which is very inhumane, says Howell. Howell balances caring for her 9-year-old daughter at their home in Philadelphia and being a long-term disability advocate. She was even named Miss Wheelchair Pennsylvania for 2023. So congratulations on that one. On Thursday, Howell was in Washington, D.C. to testify before the Senate Special Committee on Aging about her experiences. My entire life, I had to make the decisions between accessibility and affordability, as so many other Americans with disabilities do, Howell testified. Lawmakers on the committee discussed potential solutions. A Democrat-backed bill called the Visitable Inclusive Tax Credits for Accessible Living Act. VITAL Act would increase funding for the low-income housing tax credit program and aim to ensure developers are building more accessible housing units. Our Washington News Bureau spoke with Senator Bob Casey, the sponsor of the bill in the Senate. what we want to do is take the existing low-income tax credit and strengthen it, and more funding so that we can up the dollar amounts for the credits, and also to help developers in their efforts to develop more of these properties that have accessible features to them, said Casey. This hearing gave us a chance to spotlight the fact that sometimes as simple as having doorways that are wide enough for wheelchairs or other features in a home can provide that kind of accessibility that everyone should have a right to expect. And again, this is a problem that exists throughout the United States. In any state, any county you go to, it's the same problem, housing. So, and it's an issue across all states. So we really need to voice our needs, and hopefully also educate the landlords that there are funds out there for them to adapt some of their apartments, to wider doors and to have ramps if needed, take out those transitions that are problematic, light switches that are lower, etc. So it's as I say, it's all of that and some of that that really, really could make a difference. So that is it for news you can use. And now for my little piece of news, I will explain everything else. As you all know, I have disabilities like many of you, and I'm in a wheelchair. My health is taking a turn, so I don't know what will happen next. So I just have to be patient with it. If I miss videos here and there, that's why, because we're trying to work the issues out. And this has happened before. I have some digestive issues, and so it's betraying me. I was doing really well, but not anymore. So I have to go through, the usual appointments and testing and all that kind of stuff. So if I'm out for a little bit, that's why. I haven't forgotten you, and I'm and I'll be thinking about the channel and thinking about ideas and things that I can do. If I can do a couple of videos, in a row and then post them at different dates, I will do that. But if I'm missing, if I'm out, you don't see videos, it's because I'm taking care of myself. So, and trying to resolve the issues. So hang in there. Keep me posted how you all are doing. I will do my best to keep you posted. I will post a message here or there to let you know how I'm doing. And but I will do my best that at least Monday, Wednesdays, and Fridays I'll have some videos. So that's why some videos here and there are being posted a little bit later, or not at all, because I've been out, so, and down and out. So the best thing I can do is just hang in there and follow my appointments and follow the directions of the doctors, and hopefully get back on my feet. So keep me in your thoughts and your prayers. And I hope to see you all sooner rather than later. All right. Take care and be safe.